Hello, my name is Dr. Parrul Aggarwal. I'm clinical lead and senior IVF consultant. I would like to talk about ultrasounds, which is a very important modality required during the entire procedure of IVF treatment. It is not only required during the stimulation procedures for the egg pickup, but also during the procedure of egg pickup itself, also during the formation of the lining of the womb, and during the transfer of the embryo inside the womb. What we do is we call the patient on day 2 of her periods, and then we see what is there inside the pelvis. We see the conditions of both the ovaries and the uterus. So if we look over here, this is the uterus. We have to see that there should not be any pathology. We have to evaluate the lining of the womb, the texture of the womb itself, and then we have to evaluate both the ovaries. So this is one of the ovaries. And we have to count the number of follicles. We have to evaluate the size of the follicles on day 2 of the bleeding and look for any pathology there. Similarly, we have to look for the other ovary. Once we locate the ovary, we again look for any pathology, the number of follicles present in the ovary, if there is any cyst, and the size of the follicles. So after evaluating on day 2, the patient is then started on the stimulation cycle. We titrate the dose of the medicines or the injections, seeing the growth of the follicles. When the follicles they grow up adequately, we take the patient to the operation theatre, and again the egg pickup procedure is done under ultrasound guidance. We do the embryo transfer either by a fresh embryo transfer or a frozen embryo transfer. If the fresh embryo transfer is done, the embryo transfer procedure is again done under ultrasound guidance. If the frozen embryo transfer is done, we call the patient again on day 2 of her periods. We start checking the lining of the womb. We do a scan on the day 2 and check the lining of the womb. We check if there is any pathology, in both the ovaries, and if there is any cyst, and the size of the follicles again. We start her on some medications and build the lining of the womb. Once the lining of the womb is adequately built up, we do the procedure of embryo transfer again under ultrasound guidance. Hence, ultrasound is a very important modality in all the steps of IVF treatment, and it has to be meticulously done. Thank you.